Group. Now, realize.
I'm starting.
Start.
Hello. Good evening to one and all present, and welcome to another webinar episode from Physiosphere. Hope all of you are perfectly fine and all set for today's webinar. The word digital has become a staple for us, hasn't it? Especially during the pandemic. For example, Physiosphere connecting to you right now, and you watching the talks of all eminent people right from the comforting area of your drawing room. All of it are perks of digitization. Now, we stand at a place today where the whole world has literally become one big family and has been intertwined into one single frame, all of it digitally. People are getting virtually connected even more. The increasing impact of digitization is not only limited to social media, bringing people closer, but has also made its significant way into the professional and the corporate world. Even a few decades back, nobody had really thought that the world would be practically one single place and it would all happen virtually. Similarly, nobody had thought that every sector of the professional world would be centered around technology and, most importantly, digitization. So, that is the global scenario, the world being together through the gigantic World Wide Web. But it is the time we question ourselves that how far are we ready to accept the changes that follow digitization? Or how competent are we to become successfully accustomed with the digital ways of dealing things? It is the peak hour that we equip ourselves and gear up to become members of the future digital world. The pronounced footprints of digitization in the healthcare sector is quite apparent recently. So, we are going to leave you all with a food for your mind to think and to retrospect that if the world becomes completely digital tomorrow, where do you visualize yourself to stand? Coming to today's webinar, Physiosphere, on the behalf of entire Department of Human Physiology and Department of Sports Sciences, University of Calcutta, welcomes our guest of honor for today's webinar, Sushobhan Dasgupta, Vice President Lead of DePuy Synthes in Asia Pacific, Orthopedic Subunit of Johnson & Johnson. He is also the ex-managing director of Johnson & Johnson Medical in India and South Asia. And most importantly, we are extremely privileged to inform all of you that he is the alumnus of Department of Human Physiology, University of Calcutta. Today, he is going to speak on the topic, the future of healthcare is digital, and are we ready for it? After having been part of the corporate world for such a long time, I'm sure Sir can illuminate the multiple prospects and importance of recent trends and future aspects of digitization of the healthcare sector. Now, I would like to request Professor Neelkanta Chakraborty, Head of the Department of Human Physiology, University of Calcutta, to say a few words about our department's legacy. And we will also like to hear from you, sir. What do you think about the recent progress the department is making in the digital sphere? Over to you, sir.
Thank you, Shiranjana. Uh, it is really a hard time for us for this pandemic situation, but still we have learned a lot due to this lockdown condition and maintenance of the physical distance uh, between us. We learned a lot, and digitalization of this academic communication is one of them. Initially, it was very difficult to manage over digital mode to communicate. Our academics were not too much advanced at that stage personally. Now we are really have been advanced, and we are trying to move forward. And physiosphere is one of our steps to move forward further, to uh, provide our responsibilities, to show our responsibilities to our department, our academic uh, endeavor to move forward. Since 1935, when the first time this PG section was shifted from Presidency College to Rajabajar campus, several eminent teachers uh, took responsibility to develop our department, our subjects. We are continuing at present. We are, nine faculties we have in our department. We are trying our best to move forward, to advance the subject. We modified our syllabus with the inclusion of the most recent topics. Uh, Physiosphere is one of them, and that's for that particular event. I must thanks to Professor Sanjeev Day and our students of our department to take responsibility to give us such kind of academic environment. Thank you very much. With this small talk, I want to stop my. I want to give to my. Hello. Am I audible? Hello? Am I audible,
Yes, sir, you are.
Niranjana? Am I audible? Okay. Thank you very much. So we can start the program. Thank you.
Thank you, sir. So we heard from our head of the department what he thinks about the recent progress the department is making, and age-old department we have, but we are continuing to be the best. Now I would like to request Professor Shomnath Gangupathy to say something regarding the department and also to highlight the Department of Sports Sciences that has been a very proud addition to our department. And I would also like to request Sir to express his views regarding the digital representation of the department through Physiosphere. It would be indeed fascinating to know how the professors of our department feel about all of us coming together through this digital platform, trying to create an academic environment for anyone and everyone who is connected to us. Over to you, sir.
Good evening to everybody. And Siranjana, I should convey my thanks to Siranjana to put that word, that is the digital thing of our department. It's a very interesting part. What is actually what is started by the Shonjit, Professor Shonjit Day. That's a very nice thing. There's a physiosphere in which we are in a under one umbrella, and we are trying to that. As Professor Shonjit is trying his best to introduce so many our ex-students, our alumni in this under this umbrella to to share there and to interchange with these new students of our department, and also some past students of our department, with this famous and renowned alumni of our department of physiology. So I should say about a few words about the Department of Sports Science. Department of Sports Science was is actually, it was introduced in the very recently. It is introduced very recently in 1900. Sorry, in 2018. In 2018, and of course, it is under the sponsorship of Ministry of Youth Affairs and the Sports, and Ministry of Youth Affairs and the Sports. And this department is it's like a child, or is a kid of our department, like physiology. So it is going on, and now today we are very much eager to hear from from our renowned speaker, as well as our alumni, and about his experience in his field, in his own work, and also in which way we are very much eager to, in which way he will convey his his experience to our students. So I don't want to take more time. Uh, so I request, Shiranjana to proceed the program, and also I should convey my thanks to everybody, to the participants, and I should welcome everyone, also the speaker in this new platform. Thank you, thanks a lot for giving me opportunity. Thanks a lot.
Thank you so much, sir. It was very nice listening from you. And now I would like to request Professor Debashish Bandyopadhyay to introduce our speaker for today's webinar, Sushobhan Dasgupta. And I would request Professor Bandyopadhyay to share his feelings. He is actually meeting his batchmate, his old acquaintance after a really long time. And that is with the blessing of digitization as well. So I would like, sir, to say a few words on this. How are you feeling today? Over to you, sir.
Yes, good evening, everybody. I think today is a great day, meeting a very old-time friend, Sushobhan Dasgupta. First of all, I'd like to thank very much Professor Shonjit De to initiate this Physiosphere program. Um, the main objective, as I understand, of this Physiosphere is looking beyond physiology. And it was completely his brainchild, and it's remarkably appreciable that we can we can move more and more toward digitization. When I was just talking with my friend a few minutes before that India has made a leap in online communication systems, wherein students, teachers, all are interacting, scientists are interacting, professionals interact with teachers and scientists on various platforms using online system. So this is, a big leap. And I must thank Shonjit for thinking that way. The main purpose of Physiosphere is looking beyond physiology. I have just told you a few seconds earlier. Sushobhan Dasgupta and myself and many other of our friends were classmates of 1986 batch of this age-old department of physiology, University of Calcutta. A very lively person from his very studentship days. Okay, and I am very happy not only to meet him, but I thank Professor Shonjit De to give me the opportunity to introduce him, and we are greatly looking forward to hearing from him what he thinks about the digitization issue in health sector, because science is progressing, technicalities are progressing. At the same time, how can we match these through digitization, using digital methods to help our people, to help people not only in our country but worldwide? How can this the time of digitization be helpful to mankind? So briefly, I would like to introduce my old-time friend. We have had very good time when we were studying at the department, both in studies together as well as sometimes we had picnic. And Sushobhan is always a very enthusiastic person in sports. Um, so I think he is very happy today to join us, and we also are very happy to see him, and we are very much eagerly waiting for what he wants to say. Sushobhan Dasgupta currently is the Vice President and lead of DePuy Synthes in Asia Pacific, which is the orthopedic business of Johnson& and Johnson since last 4 years. He lives presently in Singapore with his wife Shornali, who is also a classmate of us, and is a member of the Johnson& Johnson Orthopedic Global Leadership Team, as well as a member of the Johnson& Johnson Medical Devices Asia Pacific Leadership Team. Actually, it's a very prestigious thing. I can understand very well. A gold medalist in business administration and a Master of Science degree holder in human physiology, Sushobhan, my dear old friend, joined Johnson and Johnson in India in April 1992 after starting his career at Nestle India in Kolkata, where he worked for 2 years. I remember one fine morning when I think he was in Nestle at that time in charge of district Howrah, and suddenly we met with each other, and we have had a little bit of very nice and pleasant discussion. Over his 29-year career with Johnson& and Johnson in the field of medical devices and orthopedics, Sushobhan has lived in various countries, working in several Johnson& and Johnson businesses in the USA, UK, Germany, Singapore, and Australia and New Zealand. In his various roles, he has led and delivered accelerated business growth through innovation, talent, and organization development. He has always been a strong proponent and advocate of business ethics and compliant business practices. When we were students, and after that also, many people used to say that, physiology as a subject in India has a bleak future. This, some people still think today. But the person like Sushobhan has proved it through his very hard work and intelligence and intention to do some outstanding work, that you can deviate from your principal subject of thinking to a subject, to an area where you can get mastery, even if you being a physiology by MSc. So this is really something wonderful. I like to focus on it. Prior to this role in Singapore, Sushobhan was working as managing director of Johnson& and Johnson Medical in India and South Asia, based out of Mumbai around for 7 years. In that role, he was actively engaged in helping shape the Indian healthcare environment through active participation in leading industry forums, working closely with the government of India. He is the past president of the very strategically positioned NAT Health Organization, past chairman of the FICCI Medical Devices Forum, and ex-chair finance, healthcare sector skills council, ex-executive committee member of the medical device forums of Advamed, AMCAM, CII, and FICCI in India. FICCI has become very popular in India, and they award scientists about their biotechnological achievements. Nowadays, FICCI award in India is very famous, right from the time of Professor R.A. Mashelkar, who have been Director General of CSIR for quite a long time. He is also a founder member of the Medical Technology Association of India. Sushobhan is the recipient of the honorary fellowship from the Association of Minimal Access Surgeons of India, a rare recognition to an industry leader. He is also the recipient of the award of appreciation from the Indian Arthroplasty Association of IAACON 2017, Kolkata, for his contribution over the years in the field of arthroplasty in India. This is a very interesting and a difficult subject, obviously. He is passionate. He is passionate when it comes to contributing to the community. And he was always passionate, as I can remember. He was very involved with Operation Smile, and international children's medical charity that performs safe, effective cleft lip and cleft palate surgery and delivers post-operative therapies. Shornali and Sushobhan have a daughter, Sriyotama, who lives and works in New York. They have only daughter. She is also a very intelligent and very much active in academics. Shornali and Sushobhan have a daughter, Sriyotama, who lives and works in New York after graduating from New York University early this year. Sushobhan is a fitness enthusiast and loves to jog and run every day, as well as play cricket, tennis, and golf on his spare weekends. This means that he has transformed himself into a personality, what we can say a multi-talented personality, and it is by virtue of which that he got success in the field that he loved for years together and became a successful person. With these few words, I invite Sushobhan Dasgupta, my dear old-time friend, to speak on today's topic of his interest. Thank you very much.
Thank you, Devashish. It's a very, very kind introduction. Good afternoon, good evening to everybody who is on this call. It's always a privilege, a pleasure, and an honor to be coming in front and getting a platform and an opportunity to be speaking in front of the alma mater, who I've so much of fond memories, and I would like to take this opportunity to really thank Physiosphere, Physiosphere, which has been conceptualized and led by Sanjeet and his team, is doing a fantastic work, and I can see that this is a culmination of some great work that they've done, and I'm very fortunate to be present today. And as you see, and I guess you can see my slide, it really talks about, it introduces myself, and truly I believe in that. I am a proud alumni of Physiology Department, University of Calcutta. And that's, I think, is a big pride that I carry and I will carry through the rest of my life. So you see, very familiar, right? This something, again, brings a very fond remembrances. The gate, the University of Calcutta gate, the Rajavaja Science College gates, which I and many of you use or used to use and go in. There were the famous staircases where we used to spend our times. The classrooms, I remember, our beloved respective teachers who provided us the very basic foundation, the lab attendants, the assistants, the cafeteria. How can I forget that? I used to spend more time in the cafeteria or the canteen than in the classroom. And I was one of the very few, though. Devashish used to be very, very attentive in class all the time. And then friends, so many friends. Those friends, many of, or maybe some of whom we have lost over the passage of time, but many of who live in various parts of the world. We are so very well connected. And as you see on the picture on the right, or below right, you can see that we were fortunate enough of some of us to come over and meet up in 2013 in a hotel in Calcutta, and courtesy to the gentleman, I would like to thank the gentleman absolutely on the right, Subir Roy, who runs a path lab today, one of the best in Calcutta. He runs there, and he was instrumental in bringing us all together. And as you see from our smiling faces there, that we really had a very jolly time. And if you focus on the top hand right, on the quote that I put it up there, and it basically comes out of two learnings that I have learned over my university days. The first one is there is no substitute to friendship, unadulterated friendship. Think about the times of the friendship that you develop at your early stage of your life, your school friends, your college friends, your university friends. Those are uninhibited, undiluted friendship where you can share, care, talk anything under the sun, and do not have an agenda. That something is completely something that is you will always remember for the rest of your life. And especially if those friendships then turn into relationships and then into very serious relationships. So like what Debashi said, that relationship became so. Swarnali was a very competitive batchmate of mine, and as you heard, that she became my life partner. And I know several of the people out there, as you see in that group, several of them have chosen life partners from the university days, and I know Devashish is one of them. He's chosen Indrila, and there are several more, I'm sure, in that batch and in the batches coming before and after that has chosen the life partner. The second learning that I would talk about is foundation. The foundation that we built together in our college and university days, and it is provided by our very respective teachers. You create the fabric, the social fabric, and the platform that helps you to take the right decisions at every stage of your personal and professional life going forward. And that comes out of the foundation. Many people ask me, hey, you did your undergraduate from Presidency College, then you did your postgraduate from Rajavaja Science College, and then you did your MBA, and then you went into your career. What did you learn from your MSc days or your post-graduation days? And you know what? I had learned many things, but my one answer that comes out when I retrospect and I think and I see, what did I learn really? The biggest thing that I learned really, especially from my postgraduate days, is the benefit or the value of the depth of knowledge. In your post-graduation days, you can go through in your graduation, you can still not be too getting into your depth of knowledge, but in your postgraduate days, you have to go deep. And that's what I learned, and that I value today. So because in any situation, any circumstances that I face today in my professional life or even my personal life, I go into depth of things. And because I go into the depth of things, I am in a much better position to provide successful outcomes through proper and timely decision making. And I give it and owe it to a lot to the foundation that has been created here. Now, when you look at this slide, it gives you a feel. We heard about this phrase, right? That out of sight, out of mind. That means that if you are not seeing something, you're not hearing something, you're not feeling something, or not maybe interacting with something, it goes away from your mind. And today, with due respect to Subir, who did all the work to get us together, how did he do it? He took the help of the left-hand side, right? The connecting glue of Facebook, of WhatsApp, of YouTube, and so many things that brought him together. Think about the past. If we were still dealing with the telegrams and the inland letters and the postcards and the STD ISD calls, would that picture come together in 2013? I don't think so. So that's the connecting glue, the digital technology and the social media that has really brought us all together. And imagine how we lived our lives even a few years back. Imagine how many of you today go to an airline ticket counter or to a travel agent physically and buy an airline ticket or even a railway ticket or even a cinema ticket. How many of you go to a grocery store? I do know, especially in Calcutta, a lot of us go to the grocery stores. Even today in Singapore, I go to a lot of grocery stores, Sonali and I go. But having said this, how much also we use online to buy grocery stores? And something a person like me, a crazy person might like me can do, which I have done some time back, and I know there will be many more people who be doing like this. I actually bought an apartment in Calcutta through the internet, not even visiting that apartment. Can you believe it? But I did it because I believed in digital, because I could see that apartment through the 3D technology, through a very well-connected internet, and I could see the entire nook and corner of the building and the apartment. And I could take that decision exactly the way I could have taken a decision if I had visited the apartment. And that's where digital technology has brought in such significant change, which has given birth to this phrase. The only constant in our lives is change. Change is inevitable. And hence there is no option than to embrace digital technology in our everyday lives. Of course, we do have a choice of embracing how much we want to embrace, but not to embrace is a big no-no. Hence, the faster and wider we embrace digital, the better for us. This brings to today's pertinent question. Can healthcare be different? Can healthcare be far behind? Can we run the ecosystem of healthcare with the same technical ability and the expertise that we developed over so many years and delay the adoption of digital and remain successful in healthcare? And the answer is a vehement no. The entire healthcare ecosystem needs to embrace the digital technology so that much faster, better, deeper, cheaper, and stronger every hour, every second healthcare can be reached out to the masses. And why will it not? Think about the benefit that accrues out of taking the healthcare. And also think about the pitfalls that happens if digital is not embraced in play. And if you see on the screen, I talk about the 4 A's and 5 P's. This is a model that has been developed by one of my gurus who used to work in Johnson & Johnson and retired, Alok Mishra. You see his copyright there below. And he developed this concept of the 4 A's and 5 P's that runs the healthcare ecosystem. The inherent part of the 4 A's are accessibility. By accessibility, I mean how much is a patient being able to access, or how much is the system being able to reach out healthcare to the patient. Adoption. Adoption is something which talks about how much the surgeons or the healthcare workers are developing the skill levels to provide quality healthcare to the masses. Awareness of the patient. How much is the patient aware? Imagine many times, and I will come back more into this as well and later in the discussion. Many of us, or several of us today, understand that we have high blood sugar, not because we are aware about diabetes, but because we are sent by a GP to do a routine blood test along with blood sugar monitoring for some other ailment that we were suffering from, and accidentally diabetes gets discovered. So the awareness level, how much aware a patient is. And finally, affordability, right? It is so important, especially in a country like India. Healthcare needs to be affordable. It has to be reached to the masses. There are people who will be able to spend. So segmentation will always be there. But how much is affordability playing a role here? And that's where the digital technology comes in. In the future, if digital plays a very important role and penetrates deeply, as I talked about, on the access, through the adoption, being aware, and providing affordability by the 5 P's, which are the spokes of the healthcare system, which is the physician, the doctors, right? How fast the doctors are adopting digital technology to be able to provide or reach healthcare to the masses through digital. That's where the provider plays a big role. The providers are the hospital owners or the group of hospitals which provide. The patient is a big thing of the P. How much are they aware, as I talked about? And the payers. And here the payers, where we're talking about a big part, is the insurance companies. The insurance companies, how much are they providing the right insurance to the patients? And the government is also a payer. In many cases, all the schemes, the healthcare schemes that have been talked about, is the payer. And on the top, as you see, in the ecosystem of healthcare, is the policymakers. Again, in policymakers is the government, the regulations, the way the imports are coming in, the way the exports are going out, the way a new product enters the marketplace, the way a procedure is coming in. Think about the vaccinations today. If the government of India had not approved of the 2 vaccines that is being now coming in on the 16th of January, hopefully that will be first put up in India. That policy making is so important for getting into the technology. So that's where the healthcare ecosystems and others play a huge and important role. The question then comes is how and where we are adopting the digital technology. And it's important to understand, the best way to understand is through examples, right? And how the way I would like to provide you with some successful examples in digital health, especially in the medical technology industry, that where I come in from, and that will give you a better understanding. Diabetes, a disease which is impacts or is affected more than 65 million people in India. So we call India as the diabetes capital of the world. Having said this, China has more diabetic population than India. It's close to 100 million people, but that's a significant amount of people are suffering from diabetes. And think about, as I said, the blood glucose monitoring. When did you first, or most patients get diagnosed with diabetes? When they go for doing a test and they come to know about it. Things changed. The blood sugar monitoring device came in, where you could buy a blood glucose monitoring device from the chemist, put a prick, get some blood, put it in your blood glucometer, and then you can measure your blood levels, sugar levels on a regular basis. But believe me, it's painful. I was running the diabetes industry, and when I used to take interviews of patients, plus I had patients at home, I could understand that it is not great. Then what happened? Digital came in. Today, you have patches, skin patches, which can go in, which is connected by Bluetooth, and that gets connected to a wearable app or your iPhone or any phones or any smartphones. That will give you regular readings of your blood sugar on a regular basis. And through Bluetooth, it gets connected not only to your phone, but it gets connected to your general practitioner's phone. What happens? Again, through that Internet of Things, through the connectivity, your GP or your physician would be telling you, hey, your blood sugar has gone up a bit. This is the medicine that need to get it. And what do? You don't need to go to the chemist. You have a digital pay system where through the digital pay system, you can order online to the chemist to get that medicine. And that medicine is delivered to your doorstep. And you also digitally can track the person who's delivering you the medicine. So imagine how digital has changed the world from going to a path lab and doing a blood test and coming to know about diabetes and then going to a GP and taking a medicine and then using your blood glucose meter yourselves and then going to a GP and taking a medicine to where it is today, where you are a patch is connected to you through a circle, an ecosystem that is helping you to get it so easily. So it's ease, it's convenience, it's efficiency, it's effectiveness, all that are coming into play. And the story doesn't end here on diabetes. Many of you must have heard about Google creating this contact lens. The contact lens, Google is creating a contact lens, will be able to understand your sugar levels through the tear. And that again, the chip will be there connected through the Bluetooth, going into your wearable device and connected to your GP. And that contact lens Bluetooth meter will trigger a drug delivery system, which will automatically deliver your drugs into your bloodstream when your sugar levels are high. So imagine I give you a very simple example. I didn't go into what the world of robotics are going in. What is the world of artificial intelligence and machine learning is doing? What is big data and data analytics going in? Those are coming in a big way. But this is a very simple example I wanted to give you to really make you understand how digital will take over the healthcare world. Another very simple example, several of you may be wearing a Fitbit or an Apple Watch to track your regular lifestyle. And today, the Apple Watch 6 that has come up, the 6 series, can not only give you your ECG, it also gives you your blood oxygen level. And the blood oxygen level today is most important, right? As all of us know, because of the COVID situation, which is a clear indicator of your SpO2 levels. And that's a great indication of how we are able to track ourselves or self-monitor ourselves through the digital technology. Another example, last example I'll give you on digital health. I could be taking hours and hours on this. But the last example I'll give you is education. And you are also well connected to it. Think about the times when COVID came in. And when the COVID came in, all classrooms were stopped. You all went into virtual classrooms. You taught people through, or taught your students through the classrooms. When you go back and think about it, and we are thinking in the corporate, I'll come to later, you think about it, and obviously you are missing out through some experimentations that are so important to be done in the laboratory. But from the theoretical classes, are you missing, except for definitely that emotional connect and the quotient that is there? Are you compromising on the quality? The reason I'm saying this, in the healthcare space, we train, especially from our medical device industry and medical technology industry, we train thousands and thousands of healthcare practitioners and nurses and healthcare alliance workers on every year. In Johnson & Johnson Asia Pacific alone, we train over 200,000 healthcare professionals in a year. When COVID came in February, and we know early, our biggest business is in China and Asia Pacific, and that's where it all started. We were very, very tensed. What would happen? How would we train our physicians? If we cannot train our physicians with the latest technology, which is face-to-face in labs, how would then quality healthcare be delivered to our patients? But we overcome that. We use technology. And I can tell you, we have been able to train over 2.5 times more than what we used to train in a regular year. This year, we have trained 2.5 times more than what we train in a regular year. And it came at 35% of the cost. And that's a clear indication how technology can change things. Now, when I look at what are some of the key digital trends that the pundits are saying over the next few years in healthcare, I see 6 trends. There are several, but I can talk about the 6. The first one is the rise of on-demand healthcare. More and more patients would use a mobile app or depend on online healthcare marketplace to understand the health and disease, as well as seek treatment by seeking across doctors, hospitals, and also doing appointments. So what does it do? It really saves time. It's zero time. It's on-demand healthcare. Just imagine again a few years back when you had something, you had to ask 5 people. You have to really look and go and check with your GP. Where do you want to go? How would you get treated? Today, it's all on demand. You press the app, you know about the disease, you know where is the best doctor available, you understand whether your insurance will cover that doctor, whether you would be out of pocket or not, and what is the modalities of treatment that need to go about. That's the awareness level of the patient that's coming in, and that would be the rise of on-demand healthcare. It will create a patient's world. No longer it will be a hospital's world or a physician's world. It will be a patient's world. The second trend that I see is big data utilization by physicians and providers. And why will they use the big data? The big data would be used for medication error reduction and preventive care delivery. Today, if you look, what is big data? Big data is an accumulation and an aggregation of all data points that have been used to treat a disease. So when you have a accumulation of such data and you do an analysis, you realize what would be the best methodology to go ahead with. And that will take away some of the errors in medication. And most importantly, I think it will talk about early intervention. Big data will give the physicians an understanding when to intervene and also when not to intervene in a disease. I see that's a very clear second trend that's coming up. The third one, virtual reality. There would be virtual treatment more and more. We've seen in the COVID times. Even when I live in Singapore, it's a developed country, and I know there are a lot of physicians, and I had a cough and cold, and I went into a telemedicine consult, which is a video consult with my GP, and that was very simple. And believe me or not, it was cheaper for me to do the teleconsult because I paid less amount of money than if I had gone and visited him in the clinic. It also saved money. It also saved time for the physician. It also saved my time as well because I did not have to go and in terms of commuting to him. So that something is a reality, and the same thing is happening in India. If you have heard Dr. Devi Shetty, who was in Calcutta before in BM Birla, now he is in Bangalore, and he comes often to Calcutta, and I know, and he's a close friend of mine, and I remember him talking all the time about teleconsultation, and he has taken teleconsultation and used it to the best. He has been reaching so many patients far flung across from the city of Bangalore, and he's not the only one. There's several physicians who are using telemedicine to consult. And I talked about virtual reality. Virtual reality and augmented reality will help doctors get better training. I talked about the example in Johnson & Johnson. Such companies.
Sushobhan, sorry, yes. I need to interrupt you. Can you just zoom your slide a little bit, because one of our participants he has requested to zoom your slide, and you can hide that the lower scroll bar. That's yes.
And zoom my slide. Give me a second.
All right. Is it possible? Otherwise leave it like that.
I will check.
Perhaps he was looking for that slide. Anyway, don't worry about it. Okay, please continue. Sorry to interrupt you.
Sorry about that. This is the best I could do. Sorry about this. Thanks for the request, but I really can't do better than this. Thank you. Now, on the virtual reality, on the training bit, I really talked about that there's a lot of surgeons and a lot of doctors are getting trained through the virtual medium. And that's happening, and that's more to happen. Because again, as I said, it will help to reach many more doctors at half the price or half the cost. And that would be the need of the hour for the healthcare professional. The fourth trend that I'm seeing, which you already see now, very important, is the rise of the medical wearable devices. You will see more and more people wearing those medical devices, the smart watches that we're talking about, because that will give them a personal health, real-time understanding for prevention as well as timely intervention. So what will happen in the future, through the medical wearable devices, the patient will take accountability and responsibility for her own health, and will not only depend on the doctor to intervene. The patient will intervene first and then rush to the doctor in question to be able to get the treatment. The fifth trend that I see that's coming up in healthcare, again through digital, is predictive analytics. And that will happen through big data. I'll give you a classic example. As you know, I've been in orthopedics for several years. And in Johnson & Johnson, we can, through a virtual process, be able to say, help the doctor to able to say that at what stage a person, when he or she goes through a knee replacement, the outcomes or the results will be this person successful. This means it's very clear through the predictive analytics that is being done, which takes all the big data, churns it out, and then finally segments that patient into an area where the doctor can say that the outcome will be accurate by this percentage for this patient. And that's what predictive analytics will rule in the few years to come. And finally, my sixth key trend that I believe is a big one that will come up is the artificial intelligence. Artificial intelligence is something that will help to generate personalized therapies and personalized surgeries for best outcome. Just imagine if you are going into a surgery, you are, through the artificial intelligence and digital technology, is providing a certain roadmap or route for treatment to the doctor, which is very personalized to your needs. It's no longer the standard operating protocol that a physician needs to follow. Artificial intelligence will give you personalized care, and that's a big change that I believe is coming in the future. This brings to where the industry is changing. It is changing. As you can see, from a physician-centered, it is going into a patient-focused area, right? What is happening is the patients are getting much more socially connected through the social network. It is no longer an isolated individual who will take his or her sole decision. Through the social connection, through the family and friends, through the caregivers, through the internet, the patient is much more aware, and that is changing the landscape. There would be much more consciousness of health and well-being rather than falling sick and then going to a surgeon or a doctor to be taken care of. Even for the doctor and the surgeon or the provider, there would be a change from limited consequences. 5 years back, 10 years back, if something went wrong, there was limited consequences, right, for the provider. Today, there are not only financial rewards and incentives, but there were punishment as well. And that's the industry that's changing. There'll be much more empowerment, much more engaged healthcare workers. It will be very convenient and 24/7. No longer we have to go into office hours and see, oh my God, my doctor is not available after 7 p.m. What do I do? Those days are over. The internet and the digital space would help us to transact, connect, and manage the team. That's the way we are. So the entire landscape and industry for healthcare will change. And that brings me to a very, very important point. What happens to people who work in healthcare outside of the physicians, maybe outside of the doctors, people like us who are in the healthcare industry? What do we do? I have a career span of over 30 plus years in healthcare, or people who are just 10 years, or people who would like to enter into healthcare or have just entered healthcare. What do they need to do? My only point here is what all of us, including me, even after 30 plus years, is to transform ourselves. We have to transform. And that's what I talk about. How do I envision future talent in healthcare to look like? I look at them. The first thing is they would be the change agents. No longer they would wait for change to happen. They would proactively make the change. There's no reactivity here. It's all proactivity. And the changes that will happen would not be incremental. It has to be transformational. It has to be done by influencing change in others and not changing yourself only. If you change and your entire ecosystem doesn't change, you won't get the results. So it's important that you influence the ecosystem as a change agent. And finally, it's on a change agent area, the speed of adoption. Whoever proactively adopts quickly would be the winner. You can't wait for others and see. It's not a wait and watch game that you wait others to take in. You have to have the first mover advantage. That is extremely important. intellectual curiosity with a strategic mindset. You have to be having, the talent has to have a very clear vision. In a corporate world, we talk about strategy. We talk about creating a strategic document which talks about the vision, the mission, the goals, the objectives, and the outcomes that you'd like to get. Have you thought as an individual, and I think about it myself, and I obviously, when I mentor people, I talk about it all the time. Create a strategic document for yourself or ourselves. Create, what is your vision? What is your mission? Where do you want to go? What interests you? What is the low-hanging fruit that you can change? And what is your ultimate goal? That is so important to develop your self-strategic document and then match it with where you want to go. And that's where it brings me the agility, the learning agility. And when I talked about digital technology, you can understand the future talent for healthcare has to have a sound understanding of digital technology and understand all the digital processes in terms of adopting into healthcare. The person has to be analytical, has to be creative, has to be innovative. And that's a part that you'll see. Hard work is essential. There would be hard work. But in the future for talent in healthcare, smart work will get predominance over hard work. You have to be multitasking. You can focus, but you also have to multitask and do well. The future talent I can see has to be very well connected and networked in the organization. You have to know the right connects. You have to know the right people. Most importantly, though not blatantly, I would use the word, don't use it, be blatant, but try and talk about what you are good at. And that's where use the social media, use the digital platform, talk about how you're good at, and be connected to people, be networked with people. Before, you never know who comes as an opportunity or what comes as an opportunity in the future. And it's all about integration. When I talk about integration, it means that how well you're connected within that network. It no longer an individual brilliance will work. What we need is a much more integrated brilliance than individual brilliance. Global with an open mindset. Open mindset is basically that you're open to all the changes. You have to be flexible to all the changes that are coming in. But it has to be much more global in nature. And I do understand we sometimes cling to our roots because of the principles and the value systems that we work. That doesn't mean that we should not keep our mindset to be global and more open. And that brings to the fifth point. You have to have or be mobile in your early stages of a career. Sacrifices has to be made. And that needs adaptability to situations. And finally, not the least, is collaborative execution. And I use the word intentionally, collaborative execution. In the digital world of tomorrow, you cannot execute without being collaborative. You cannot execute without being a part of the team. You cannot execute if the team goals are not met. Individual goals met are great, but if the team goals are not met through collaborative execution, that will not happen. So hence, I'll leave you all with a final thought. And that's a question even I pose to me every day, and I pose it to you today. Where are we? Are we ready to embrace the change and learn new things, no matter at what stage of life are we in? Would we proactively change, or would you let the situation change you? The answer lies in each one of us. Thank you, and back to you.
Thank you, sir. That was Indeed, a very nice session. And I would like to say that we as students, we hardly get an insight into the practical world. Like, it's very important that we have somebody to guide us beyond those walls of the university. We are gaining the knowledge here, but how is it coming into practical use? That is very important. And it was really nice listening from you, especially because we are from the Department of Human Physiology, and healthcare sector is so closely associated with us. And you having been a part of it, you shared your experience with us. It was really nice. And I think a lot of the people have benefited from hearing to you as well. And that is very evident from like so many questions we are having on the live stream. So people have really enjoyed the session. And now I think we'll start the question answer session, and we will
Hey,
take a few questions from the audience.
Sriranjana, just to interrupt, I'm just being very sure. Is my slides
Yes.
visible, or the slides are off and we are on the screen now?
No, slides are off and you are on the screen now. The audience
Thank you.
can see you.
Thank you.
Okay. So now we'll be moving forward towards the question answer session, and let's take a lot of questions are there. We'll take them all one by one. Mustafizur will read them out to you. And firstly, I would like to inform you something, that many of your batchmates had actually joined us, and I think Durba ma'am and others were also there, and they are indeed overwhelmed to hear from you after such a long time. All perks of digitization. And we are also very happy that we could actually bring so many people from the department together on a single platform. And it's nice for us. It seems like we are getting, closer to success. So,
privileged.
yes. Yeah, thank you so much. So we will start the question answer session now, sir. The questions will pop up on the screen, as well as our friend also will read it out to you. Over to you, Mustafizur.
Mustafizur?
World. Am I audible, sir?
Yeah, now you are audible. Okay.
Hello,
Mustafizur,
sir.
please
Am
say
I?
again. Please say again. Please say once more. So now you can also see the question, right? So what are the things that learned in the education world that could be useful, that could be used in a corporate world? So that is a question from Aniket.
Yeah, thank you, Aniket. It's a very very good question, and as I said earlier, your formative days is your education world. What you learn in your formative days, which is in school, in college, and in university, remains with you for the lifetime. And we do not understand when it influences, but in situations, it really influences. In the education world, as I said, in the university, what I learned is the depth of knowledge. There is no substitute to depth of knowledge. You can learn a lot of things, but if you do not get into depth in certain things that you have to establish as a career, that's an education world learning that you can take into a corporate world. Because believe me, in a corporate world, you cannot take decisions unless and until you can get into the root cause or the depth of the situation. Your decisions will invariably be wrong. So that's something that you learn in the education world. The second thing that I learned personally through the education world is discipline. And I think imagine your school days, your college days, and your university days. And I still remember, if we were late in class, we used to freak out, right? And that's the discipline you learn, because in a corporate world, there's nothing called being late in meetings. You can be late once, late twice, but that doesn't work. And that's a discipline that you learn from the education world. And the third important thing that I would say that I have learned, and I'm sure many of you learn from the education world, is respect. And I think you have seen how we have respected our teachers and how our teachers have cared for us. You take it to the corporate world. When you become and you join at the early stage of your career, you become a follower. And when in the later stage of your career, you become a leader, you understand that concept of respect and caring. The mutual respect that happens between a teacher and a student in the world of education gets carried forward in a corporate world. And that's a very important learning, because with respect and caring, you are successful as a leader in a corporate world, no matter which industry you are in. Hope that answers your question, Aniket.
Thank you, sir. Moving to the second question from Debashi Bashak. How can we reduce the health hazards created by using prolonged screen time in digital education among students or children?
Lovely question, Devashish. I really like it. And I will give you an answer what we use in the corporate world. So obviously the prolonged screen time in digital education is coming because today that we are not being able to go to our classrooms and to our universities and to our schools and doing it. So obviously it is keeping us more engaged in prolonged screen time. The same thing, believe me, it's happening in the corporate world. I start my day at 7 in the morning because Australia, which I'm in Singapore, Australia is 2 hours ahead of us. New Zealand is 3 hours ahead of us. So it's 10 o'clock for them, at 7 for me. And then in the US, it's around 5 or 6 in the evening for them. So my day starts at 7. And in an era where we are not being able to go to office or not travel to other countries, you have to sit in front of the screen. And what we are doing from 7, it's going on and on and on and on till 11, 12 midnight on a regular basis, except Friday evenings. So my answer to your question is, I think we have to balance ourselves in terms of how we manage our life going forward. What we do, we ensure that we have breaks. And I think that's important in the education space as well, that the teachers need to understand, and I'm sure they are understanding, that they would give proper breaks to the people or to the students. Secondly, the advantage that you have is sometimes you have the flexibility of moving out of your chair and standing. We don't always stand in front of the screen or sit in front of the screen. We actually do a bit of stretch, move away from the screen. And I think the same thing can happen as long as you are paying attention. You could do the same thing for digital through education. And finally, as I would say, the education, the process of education is changing. Think about the times, and I remember several of the alumni will remember as well. How were we trained? How was the education system at that time? What is the education system today? At that time, we had to memorize a lot of things. Today, the education, do you need to memorize a lot of things? Or do you have a consultation mechanism through the internet or several other aspects that I can use? That smart learning thing is coming. When the smart learning thing is coming in education and the digital area and opportunity comes in, that health hazard can be reduced through a proper educational system as well as smart way of balancing one's lifestyle. That's the way I would look at it, Devashish, to your question.
Thank you, sir. The next question is from Oishi Mojumdar. Tell us about your experience and your career journey that might help someone who has done masters in physiology.
Thank you, Aishi, for the question. And you know what is, I really actually, when I look at my career journey, how has masters in physiology has helped me? Honestly speaking, and I know that most of you who are students or have been very recent students have a much different outlook than what I used to have or several of our friends used to have. We never thought about a career before actually we went into post-graduation. So we were much more carefree. We used to play, we used to we were not very sure what's going to happen. Whereas I think when I see my daughter and I see several of the students today, we all are much more, I would say, smart in thinking your career. So I really didn't have a thought. But having said this, I would say my master's in physiology has really helped in my career journey because it has given me an understanding of human physiology. So when I started in Nestle, as you know, is a dietetic company, right? So I had specialization in nutrition and dietetics. That helped me in terms of my career and my prospects. And then after my MBA, I went into Johnson & Johnson way back in 1992. The physiology experience helped me because I went into a department called wound care and general surgery. And in wound care and general surgery, the human physiology aspects worked a lot. And obviously, as I said, the discipline, the culture, the environment, the respect, the caring that was taught through the university has helped me. So if you ask me, has masters in physiology helped me? Yes, it has, because it has given me a platform of healthcare. So it was much easier for me to gallop into a healthcare world with my physiology knowledge. Because when you look at my work involves a lot in speaking to stakeholders, including government officials, including customers, including surgeons, including hospital providers, including policymakers, where your knowledge of physiology helps to have a peer-to-peer conversation, an equal-to-equal conversation. And that really helped me in my career journey in healthcare. Thank you, Aishi.
Thank you, sir. The next question is from Sushobhan Bishas. Indian healthcare ecosystem in some cities are highly regarded in neighboring countries. How is it comparable to other South Asian and Western countries?
Thank you, Sushobhan, for the question. Now, when you look at the Indian healthcare ecosystem, it's highly regarded is a statement that I would put up in inverted commas. And I'll tell you why. First of all, how is it compared to other South Asian and Western countries? Yes, it is better than some of the South Asian countries. But when you compare to the healthcare ecosystem in Singapore, or even in Thailand, or even in Malaysia, I would say these countries are far superior in the healthcare ecosystem. If you look at countries like Australia, China, Japan, Western Europe, the US, I believe the Indian healthcare ecosystems do not compare with them at all. But then again, say, where are we lacking in some of the Indian healthcare ecosystem? I think the big area, and I talked about the 4As and the 5Ps, right? And if I take some of them, so look at the 5Ps in terms of the physicians. The physicians actually in India are one of the best in the world. The knowledge that they have, the expertise that they do have, the digital technology that they have adopted is definitely one of the best. The awareness of the patient, is it high in India? Unfortunately, no. Today, the intervention is far less for any disease state because it goes into much later stages. Today, why do you see so much of patients die out of cancer in India? The reason being is that it goes into a much later stage. They go to a physician at a much later stage. And why does it happen? Because our Indian healthcare system do not have a mechanism of preventive health. We focus a lot on after we get the disease. We do not focus a lot on preventing a disease. Think about all the people in this Physiosphere seminar today. How many of you or I do a routine healthcare checkup once a year in India? And think about in several of these Western countries and some of the developed countries, including Southeast Asian countries, how many of them do? I do not have the numbers, but you'll be astonished. When you look at a 1.3 billion population, and then look at the number of people who do preventive maintenance, as I call it, or preventive healthcare maintenance, as I call it, as a ratio, and then you look at the other countries, India is way behind. So, to your question, Sushobhan, in certain aspects, we are good, but in many cases, the Indian healthcare ecosystem is in a very nascent stage. It needs to develop a lot, and where the government needs to take a play a much bigger role. Take a comparison of China. Today, China in the healthcare ecosystem is far superior than India, because the universal healthcare that we talk about today in India is being there for a long time. Every Chinese national is well covered by the universal healthcare. And believe me, they get the best of treatment. If you go to a public hospital in China, which is like some of our public hospitals in India or in Calcutta, you'll see the difference. You will think, if you go to a public hospital in China, that you are possibly in Bellevue Clinic or in Woodlands Hospital or in AMRI in Calcutta. And that, I think, is a huge difference, because they have the infrastructure, the government has put in the resources, the infrastructure, which is still not there. So there are certain lacuna, but I have a strong belief. I am very positive about the Indian healthcare ecosystem being much better. There are a lot of stakeholders, the private enterprises, the government are understanding that health is wealth. If health of the Indian citizens are not good, the economy will not go in. And that's where I see a bright future for Indian healthcare going forward.
The next question is from
He's I think he's Mr. Dash, Guru Dash. I think Vector is his middle name, Guru Dash. So the question is, so you can hear me, right?
Yes, I can hear you. Thank you.
All right. So Mustafizur, I'm reading it for you. Okay.
Okay, sir. My network is some trouble.
Oh, okay, that's great. No issues. So to Sushobhan sir, as you said that India is diabetic capital of the world, how would your leads help support to fight against it or the spread of it?
So when you say leads, I believe you're talking about, again, the healthcare ecosystem, right? So if that's what I understood, I believe absolutely you said it right, is that India is the diabetic capital of the world, and there's a lot of ways to counter it. And the way to counter it is, the first thing, as I would say, is the awareness, the spread of awareness. Because diabetes, and diabetes actually is, as we call it, is a silent killer. It's not an accident that happens in the road, which maybe kills a person, or instantly, or maybe delivers a paralysis on one side of the life, or something. Or it's not cancer that you're getting to stage 4 that in 6 months' time you would not survive. Diabetes is a silent killer. And that's where I think the biggest problem in India is that the awareness level is not high. I know several people, including in my family, who are in the pre-diabetic stage, whose HbA1c is over into the pre-diabetic area and over the normal area, and may go into the diabetic area. Still then, they don't pay heed to it, unless and until it goes into the diabetic stage, and then you start taking a metformin. And I think that's where I believe is the awareness. All of us put together could create the awareness, ensure that 2 things happen. One is we do regular health checkup and see and understand where our blood sugars lie. But the second big part of the awareness is lifestyle. How many of us ensure that our lifestyle are healthy, we exercise well, we eat well, we resist the temptation of regularly having a sweet dish after, and a dessert after our dinner. How many of us do it? And I think that is very, very important. Awareness. And after the physicians are there, the technology is there, the treatment is there, the medicines are there. But I think the area that I would focus on to fight against diabetes is awareness of patients and early intervention by patients in terms of a regular checkup as well as healthy lifestyle. Hope that answers your question, Guru.
Thank you. Mr. Vijay, are you there?
Thank you, sir. The next question is from Pronshupriyo Nayak. While digital healthcare is supporting all the individual stakeholders, is it not ruining the future of physical health support system in rural and less developed corners of countries like us?
No, not at all. I think this is absolutely the reason I think is your question is coming up is, are you thinking that digital health will substitute the physical health support systems in rural? Not at all. In fact, digital healthcare is an enabler. It's a platform that is enabling the physical health support systems in rural to reach more and more patients across. It will give you more speed. It will give us more efficiency. It will give much more ease of reaching out to people. And most importantly, it will deliver repeatable, sustainable, and successful outcomes time after time when we reach out to these rural people. So to your question, it is not, it's actually digital, but getting into digital, it is actually augmenting the physical health support system. And my point here is sometimes we feel that digital healthcare is expensive. No, it is not. I think it's important to understand the healthcare economics here. It's in totality. You cannot look at in isolation. When you look at, okay, getting a mobile app, getting a smartphone or a normal mobile phone, getting an internet cost you this amount of money. But when you take the cost on one side and then you measure it against the benefits on the other side, and you would do a plus versus plus of benefits and minus of the costs, you'll realize that digital healthcare actually is much more cost effective and efficient versus not adopting digital healthcare.
Okay, very nicely explained. Sushobhan, I think you have answered many questions, but still many more are lying. So would you, like to take more questions? At least how many questions you would like to take?
I can go on and on. Up to you.
Okay, so I'll go ahead with the 4 key questions. Okay, all right. So because it's a very long session for you also, and all right. So okay, again a question I think very pertinent to you. I'm just keeping some of the earlier questions. I think the same question from the Prashun Nayak. He's also our alumni, and so he actually made a very pertinent question.
The next question is from Pronshupriyo Nayak. What are the possible motivations for a physiologist to take up corporate job and vice versa?
I think the answer lies in that individual. It does not lie in a physiologist. You could be a physicist or you could be a marine biologist and take up a corporate job, or you can pursue something else. And that's where I think I'll try and answer my point of view here. So I studied physiology and then I moved into a corporate job. Why was it so? And this is, again, as I said, I will be very undiluted in my answer. The reason being is, number one reason was money. What was driving me at that time? Money was driving me. I saw a couple of my friends from physiology take over a corporate job, and I could see them whenever we were meeting, they were just bringing out their wallet and spending a lot more money, paying off for our drinks and our dinners and everything. That motivated me. So that was my number one motivation in the corporate job. But the second, also, the corporate job that motivated me was the career progression. I always wanted to become a CEO, always. And I realized that if I have to pursue my motivation of being a CEO, the only place to pursue quickly with my credentials and my ability is through the corporate, because I could be a CEO of some other organization which is non-corporate. I wouldn't get the money. So I needed the money. I needed my ambition to become a CEO. That really motivated me to go into the corporate and realize my dream. The question of yours is, what are the possible motivation for physiologists? I think, as I said earlier, it's your personal motivation. You have to develop your strategic document, your life document, and say, what is your vision? What is your mission? What is your goals? What do you want to achieve? And does that corporate job take and let you achieve your vision, mission, and your goals? If that does, go for it. If it doesn't, pursue what you would like to do. Because finally, let me tell you one thing, is after a certain period of life, you'll realize enjoying the job is the most important part. That should be something that you should always take care of. Job satisfaction and job enrichment are the two best things that you need to take up to be successful. The rests are not so important.
Thank you, sir. The next question is from Abhishek Das. What are some essential learnings to be acquired in the digital space for an individual to be successful in a corporate environment?
Yeah, I think I covered this, Abhishek, but I will again repeat. I think you have
Yeah,
to
just
have,
briefly you can say. Yeah, you are right.
it has to be agile learning mentality, and look at what's going on in the digital space. What is happening in technology that is shaping the future of healthcare in a corporate environment, I would say. So learn some of the aspects of how you can use digital in your day-to-day life in a corporate. And that's important. If you are connected to a customer or you're connected to a stakeholder, how could you be able to connect the digital ecosystem? That's something is some of the learnings. It depends on corporation to corporation, industry to industry, individual to individual. But it's important that you need to understand what you need to acquire. And again, I'll bring back to that point here. One is, don't learn for the sake of learning. You need to have the interest and the gumption to learn. And the second thing is, you need to understand, by learning this, where will it reach in that personal strategic document I talk about? If it matches, go for it.
Just so there are a couple of other interesting questions, but I think now we need to conclude the session, because
Sure.
otherwise it will be very hectic session for you also. So just quickly, I'm two pertinent questions altogether, I would say, put up altogether. So first is that
Next question is from Ushmita Saha, who is doing undergraduate course in physiology. What are the career prospects open to us, and how do we make ourselves prepared for it?
okay. So
Yeah.
another question. Okay,
Yeah.
just a second, Sushobhan. So there is just similar question. I think it would be pertinent one. So just to read it once more, Mustafizur. Mustafizur. Okay, I'm reading on his behalf. So, being an area of the corporate health, how would you feel about the opportunity of physiology MSc there? What changes you suggest for our new physiologists for their better suitability in the corporate world? So, more or less similar. I mean, I think it's a linked question.
Yeah, it's a very similar question, and the way I would answer is your prospects, first of all, are very high, because the reason being is, you are already getting a great understanding of healthcare. And when in a healthcare environment, a healthcare corporate usually takes a person into the corporate role when you have a better understanding of healthcare. Because most of the areas that I see, you would be either getting into sales and marketing, or in commercial operations, or in R&D, or research and development, or maybe in analytics. You never know. These are 4 or 5 areas that I see which will open it up for physiology. So if you understand which are the areas that you want to go in, your healthcare background will be very helpful. Now suppose you have, though you are studying physiology, but you somehow have a good understanding of numbers. You have an analytical bent of mind. Think about it. Can you get into healthcare data analytics as a stream? Then you look at what are some of the specialization courses that are happening in India on healthcare data analytics. And you get into that course, get trained on that course. So what happens when you pass, whether it's your undergraduate or postgraduate in physiology, and have a specialization next to you in terms of the subject of interest, whether it's in data analytics, or whether it's market forecasting, or it's market research, or is it sales and marketing, whatever it is, if you have something along with that, that helps you. Otherwise, if you, for example, if you are in undergraduate course in physiology, the best way is to start like I started. I started my career in Nestle as a frontline salesperson. And I started there. And then when I left, and I realized after 2-3 years of doing a frontline salesperson, I would not be able to develop my career if I don't do an MBA. So I did an MBA. Then I joined as a manager in Johnson & Johnson, again a healthcare company. I got an offer back in Nestle, but I chose Johnson & Johnson. And from there, I put my career through continuous learning. So to your question, Asmita, and someone else who asked a similar question, Prasun Priya, is the answer is very clear, that we need to have a regular learning cadence of what we need to do to be able to go in and be successful in the corporate world. Because corporate world is tough, let me tell you. When you go in the corporate world, you get into a very different space. It's like, oh my God, this is not the world that we came from. But then, if you are well prepared in speaking that corporate language, well adapted to be able to embrace the nuances of the corporate world by being prepared much earlier, that would help you to get into corporate very easily.
I think next corporate people have a question that similar way.
Next question is from Shomoprabha Ganguly. What are the key obstacles that most people face with while entering a corporate world?
Yeah, the first obstacle is your own mindset. You need to move out from a college mindset to a corporate mindset. That's a big, big, big change, I can tell you. I recall my days when I went into Nestle. It was a very different environment that I had to face. But then, if I would say the key obstacle is in your own mindset, but the second thing I do not see are any other obstacles. It's just your own mindset. All the others are simple. People in the corporate world understand, and they would embrace you. They will teach you. But it's important that you have a very open mindset in terms of that you're moving from a education or college area to a corporate world. But secondly, and most importantly, is to have an open mindset, a learning and agility mindset, that you need to learn, you need to grasp as much as possible. Be a learner. If you have that mindset, entering corporate world is easy, and there would be no obstacles.
Okay, I think we should conclude the question answer session because it's going to be very beyond our time. So all right, now I think Sriranjana should take care of the next session.
Yes, the question answer session was very interactive, and I think so many people had questions to ask, mostly because this was a new thing. that many people came across. And from physiology to go into a corporate world and then to share your experience, it was really nice, a very enriching experience, I'm sure, for all of us. So lastly, now I would like to
But
request.
Sriranjana, one thing I would be remiss in missing it out is, and
Yes,
I know you guys have many of you have gone through the image management program
yes,
of
yes.
Dr. Mrs. Swarnali Dasgupta, and that's important. And I would be remiss if I don't mention it. And she took the pains of really giving you some very important tips, and it's important. And I'm being on a serious note, it's important to have the right image. You have to shed the college image and get into a corporate image. And I know she's talked a lot about that. I don't want to go into details, but like as you change your mindset, you need to be ready to change your image, and that would be a big clincher. The faster you do, and more you're aware of your image and the way you present yourself in a corporate world, the more you'll be successful.
Yes, absolutely. It is complementary. Complementary. Yes.
And Shornali ma'am, she just explained things to us in a very nice way, and the overwhelming response we had from that webinar, and I'm sure many people were benefited from it. And she also showed us like many different things that we weren't really aware of, how building up your image can be of help, and the same thing you highlighted today. So I'm sure that was nice. And so I would like to know from you first, how did you enjoy today's session? How was it speaking to so many people all at once and so many interactive questions coming up? So I think you have something in your mind. So first, let us hear from you.
Okay, before I talk about how I felt, I need to talk about how I felt when I got this opportunity. And I think it's important for all of you to understand is I felt a sense of privilege, a sense of belongingness, and a sense of gratitude. Because I always feel at the back of my mind that I owe something to be given back to my alumni. And I've never done that. I'm being very honest. I've been moved out of it. I've been off into the corporate world, into the hectic sphere of the corporate world. So one of the things I'm committing here in this forum, that maybe in a couple of years' time, when I will be not so much engaged in the hectic world of the corporate, I would certainly give back time in whatever way I can do to young students through this Physiosphere platform or to any other platforms that you guys will suggest. So now you can understand how well and how I feel. It brings me back some of the great memories that I have, gives me immense satisfaction, and gives me so much of happiness to see familiar faces, and not being able to see, but understanding that so many known people whom I know and cherish and love for so long are hearing me with patience. And that's the gratitude and the biggest takeaway from me.
I think that is a very big achievement for the department also. That is where the beauty of the department lies, that so many of us, we share the same platform and we are all overwhelmed to be associated with the department, and the name stays with us forever. And we love to keep the name. That is the respect we owe to the department. And now I would like to request Professor Roshnara Mishra to say the vote of thanks. And I would also like to hear from you, ma'am. How was today's session? How did you enjoy it?
Thank you, Sriranjana. Good evening. I'm very happy to propose a vote of thanks, as this is my opportunity to express the gratitude for belonging to this department. The department, which can boast of such notable alumni as our today's speaker. Sir, thank you for such a warm and engaging speech. For the lucid way you made digital healthcare and its future trends understandable, which I think can help us in setting research directions. For the much needed push in the time of global crisis, and for the wisdom and openness you have shown in answering all of our questions, and also for the promise that you will come back to us when you retire from your present schedule. Thank you for today and for days to come, when your encouragement will remain with us. My thanks to our university authorities who have made the digital platform readily available to us, our respectable Vice Chancellor, Pro Vice Chancellors, and Registrar. Heartfelt thanks to our HOD Physiology, Professor Nilkanto Chakraborty, and Coordinator, Sports Science, Professor Somnath Ganguly, for making this evening possible and for bringing 4 departments together for this webinar. They were the leaders in rapid digitization of the department in the time of need. Thank you. Thank you, DB Sir, Professor Debashish Bandyopadhyay, for introducing our speaker with such pride in our department and batchmates. It was most endearing. But most remarkable was how you made the introduction a very interesting discussion in itself. I'm immensely thankful to my department, my evergreen colleagues for their enthusiasm and active participation in the webinar, our dear students and research scholars who have actively participated and have raised so many questions. Thank you. Thank you, Sriranjana, for comparing the program with very professional efficiency. Also, your voice was vibrant, which set the tune of the event. And at last, this is the only opportunity to properly thank Professor Shonjit Dey, the man behind the event, who have taken the initiative of this webinar series and have made it possible by taking care of every detail. But most of all, it is the idea of bringing back our star alumni to us as a constant source of inspiration, for which I thank Professor Dey from most heartily. Thank all of you for being together this evening. So many of our alumni, batchmates of our speaker, my seniors, juniors from this department. It feels almost like a reunion seminar, only without the grand feast. Thank you. Thank you very much.
Okay. So anyway, so in coming days we will have our grand feast. We will have our treat, great treat, and
Sure.
yes, many of our colleagues, they are excellent in organizing the meetings and the reunions. So we have made it. So we will do it. No issues. And on a so as a concluding note, I must thank Dr. Mishra for giving us such a nice vote of thanks. Excellent. So I'm really happy to have you here. And so still more questions are there. So, but I am not going into those questions right today. But I am very happy that the essence of this seminar, I mean this webinar, is very successful because Sushobhan has ended with a very very positive note, and he and Sharnalidhi, both of them have put the department in a very positive way. So now I think we would be more professional, okay, from seeing you and from taking your guidance. So it is an excellent take that I can say. Okay, so all the best. Please stay safe and stay healthy, and always play cricket or make yourself fit like Sushobhan. Okay.
Hey, Sanjay, before you conclude, I really want to say a huge thank you first to our excellent compare, Sri Ranjana. You are really eloquent and very suave, and thank you for being so articulate in whatever you said.
Absolutely.
To Devashish, my dear friend, thank you for again such a kind introduction, and you really personalized it. So I loved it, the way you spoke. That was great. To Somnath Da, and I think he's not there.
Yes.
To Nilkanto, he's not there as well, for giving such kind introductions. Professor Mishra, Thank you so much. As everybody said, it was fantastic vote of thanks. So thank you. But I think I would like to really thank, congratulate, and wish all the best to Sanjeet. I think you have been the architect, the backbone, the real support behind everything. And I think getting everybody together during this pandemic times and organizing this show so
This is
well,
very
it's really a corporate benchmark, I can tell you. So huge congratulations to you and the
All
team
right.
at Future.
Thank you.
Thank you, and all the best to you as well.
And yes, and all my teammates. I didn't mention. Behind the scene, Mustafizur was there. Also, Shubham Bonik was instrumental today. So, in spite of that, there was some technical glitch, but you didn't understand it. So he had some power cut there. But anyway, we managed it. And our team leader Shouti is not present today, but anyway, he made all the arrangements for us anyway, and all the other members also, like Ishika. So we must mention Ishika about you, because she made the poster for you. Okay.
Oh,
so,
nice. Thank
so,
you.
so they
Thank you.
worked behind the scene, so they are excellent worker. So I think it is for their motivation. I think you will work again. All right. So all the best. And say again, I would say with the warm welcome note, rather than say you adieu. All right. Good night.
Good night.
Good night.
Thank you. Bye.
Good night, everyone.